think there's two broad strategies. First of all, we think there really are opportunities to make the information better, and by that we mean more practical. There's a lot of research evidence that we know tends to sit around on the shelf and not get adopted. One reason may be that despite the fact that the research is very well done, it doesn't quite answer the right question. It doesn't do the right comparisons. It doesn't consider the outcomes that really concern the patient and clinician. It wasn't done in patients like this patient we're talking about today. So better information, better populations, better questions, better outcomes. The second whole strategy, though, is that we need to understand better how we disseminate or share information, how we make it available, and how patients and their providers talk about it. So, given the information, how does a physician or provider, clinician, put that information to the patient so that they can really weigh things, so they don't feel maybe pressured? And the second is, how do we arrange the healthcare settings, the systems in which patients and their clinicians are working, in terms of everything from access to care, having enough time to talk about it, to having the educational information there, to not having financial barriers in the way of making the choice, to not having those influences. Systems do a lot, or sometimes systems don't do enough. So improving communication dissemination, improving systems, and attending to the fact that patients may differ in what they prefer. Patients actually may differ in how treatment works, if you're older versus younger, if you have other conditions versus you don't have other conditions. So I've really just told you 4 of our 5 priorities. By that I mean that now that the priorities and the research agenda are posted and we're getting input, and we anticipate having a revised, hopefully, final version of round 1 of the priorities and agenda by mid-April, we need to begin sitting down. Not that we haven't been talking with stakeholders, but we need to begin sitting down with patients, clinicians, and others to hone in on some key questions. So PCORI always wants to be open to a good idea no matter where it comes from. PCORI also feels that there are likely key areas where PCORI can make a special contribution. We'll only identify those with pretty extensive engagement and dialogue. I'm not quite here to say that patients care about PCORI yet, because I think most patients don't know about PCORI yet. I think patients care about having information because they or a loved one have faced situations where they really didn't know which way to turn. Oftentimes they were getting conflicting information. Oftentimes they maybe thought they knew which way they wanted to go and they were being advised strongly to go in another direction. Treatment choices are increasing in numbers, and different treatment choices have different consequences, and patients may have a sense of that, may appreciate that. They could use the information presented in a usable manner.
And is that how you would define success for PCORI?
I think we'll define success if we succeeded in generating research that gets acted on, that doesn't sit on the shelf, that changes practice, that patients say was useful in making a decision.